Why is it analyzing? All right, so analyzing, you have to you have to um you have to deduce then. This is a multiparous woman. That means that she have a lot of children, 8 weeks pregnant, right? She explained that to the nurse that she missed her period and is experiencing fatigue and tenderness. Which other presumptive sign of pregnancy should the nurse expect her to have? So you have to know the presumptive signs of pregnancy, number one, and then you will have to know from the option, you will have to analyze now which one of these falls in the 8 week. So the analysis now is telling you, um, okay, it's testing the information you know and see if you can decipher things. Or can you check what's right or what's wrong um, based on the question. All right. As we go through, we will find out. That is analyzing. Applying now. This one. A healthcare provider performs an ultrasound and observes fetal cardiac activity. The finding should be documented as a whichever sign. So this here, which is a positive sign of pregnancy, this is applying a situation. So it has a scenario, and what would you do in that scenario? That is applying. Are you understanding?
Yes, miss.
All right, so let me go back to something there. All right. So let us go. Let us talk about the
Miss,
orders
before
of
you
things.
go forward, can you go back to the slide before, please? Just a minute.
This one, this one, Shari. Hello.
Yes, miss, I got it. Thank you. You can move on now.
It is in the blueprint, all of this are in a blueprint.
Yes.
All right. So, all right, let's talk about the different areas now. So, this is knowledge and comprehension, which is remembering and understanding. 20% of the paper will be this. So it will ask you to recall previously learned material and understand its significance. Can you interpret the information? That is what it is asking. That's the basic level. All right, 20%. 50% of the paper would be applying. All right. Can you use what you have learned in the scenario provided? So, can you use what you have learned, rules, regulation, methods, nursing principles, and theories in the provision of safe and ethical nursing care of the patients? So, if they give you a scenario, can you do what you have learned? Can you apply what you have learned to this situation? Then there is the analysis and evaluation, and that accounts for 30% of the paper. So, can you determine priorities, distinguish between relevant and irrelevant data, justify decisions, and make justifications based on consideration of all the available evidence in the patient care situation? So, when they ask you about priority, that is analysis or analyzing. Which one would you do first? or what is the priority? Those are analysis questions, analyzing questions. For evaluation, no. One evaluation question could be like they're asking you, um, what is the best action of the nurse in this situation? Because you need to know which is the best action. So evaluate which one of them is best. All right. So when you're taking the exam or when you're doing the test, the exam, you have to identify keywords. So that's why I always say read and underline the keywords. Look at the keywords. Sometimes they are repeated words, they are odd answers. So we take them out. The opposite answers and all of the above. So depending that you have to read the stem really careful. All right. So the stem is the question. The stem is the questions, and then the options are the A, B, C, D. Read it very careful. They're going to be saying, so the keywords are, maybe they will repeat a word, or which one is not, or which one is the odd one out, or those kind of things. So you have to look at it, because sometimes we just browse over the question, think we see what we see, or think we see what we know, and then answer it, and then it's completely wrong. All right. Know whether you are being asked for the correct or the incorrect choice. Based on item writing principles, they are trying to cut out the negative stems, or the negative stems, where we ask which one is not, or which one is the incorrect, right? But they still write them. It's not so prevalent as in back in my days, but they still write them now, as in what is the incorrect choice, or which one is not supposed to be there, or something like that. But it's not so prevalent, but still look out for it. All right. When you're answering your questions, eliminate the obvious incorrect answer. Right? So they ask you a question, they say, well, this one cannot be. Say take out it, right? If you don't know the answer still. If you know the answer, you go. But if you don't know the answer, you can eliminate the incorrect answer. Um, or something that is unrelated to the question, you eliminate it. Or if you know the answer, just take it and go on. Yeah, the absolute answer. Identify prioritization questions. Questions using words such as initial, first, best. Yes. So we look at it and we say, okay, this is asking for priority. So yes, all of the questions, what all of them are question, you're right. Yes, all of them right, but a one can be priority. All of them cannot be priority. So we know how to prioritize. All right. The choices are usually all correct, but only one should be done first. That's what I said. All right. So which one should be done first? We see that in the diagnostic test the other day, right? All right, prioritization technique. When prioritizing, you should consider the following: A, B, C, airway, breathing, and circulation. Patients with airway problem or interventions to provide airway management are top priority. 1 minute. All right, sorry about that. So, we think about the ABC. All right, patients with airway problem or intervention to provide airway management is top priority. The Maslow hierarchy of needs, psychological needs come before safety and security, but not in all cases, not all the time. Um, and the psychosocial problems. This is typically used in complex patients with multiple problems. All right, so the Maslow hierarchy of needs, you have to think about, is this patient stable or is the patient unstable? Is the patient illness chronic or acute? um is this a urgent situation or is it not a urgent situation? So based on what you have learned, you'll be able to um prioritize the needs. When you find a patient with multiple problems, what you need to ask yourself is, um which one of these problems can cause immediate danger to the patient if not resolved? Yeah, if me not correct this, what is going to happen? Lay them out on the paper. If me not correct this, what is going to happen? If me correct this and left this, what's going to happen? Yeah, which one of them are threatening the patient life? Yes, and then we can get our priority. So the nursing process assessment should always be done before planning anything or instituting interventions unless all the relevant data is available. So we always utilize the nursing process, assessment, diagnosis, planning, intervention, evaluation. All right. So when you get a question, you should read each question carefully. Look for hints in the words of the question stem, which is the stem or the question. Reword the question in your own words. So try and find out what it is asking. So what happened is that sometimes they put a long stem there, with one whole heap of information. And then sometimes the information is important, sometimes we realize it's not. So after reading all of that long information, you are going to ask yourself, what is this question asking? Which is normally the last part of the question. The question is always the last part of the stem. So, what should be done first, or what is the priority diagnosis? So, after all of that information, you ask yourself, what is the question asking? All right, if you can't complete 3 steps, read the answer choices for clues. So after you reword it in in your own words, you still can't get the answer, then you start looking the choices for clues. Eliminate the incorrect ones, and then you know you find the answer. All right, when to call the doctor? After an intervention has failed and there is nothing else the nurse can do, or when the patient exhibits signs and symptoms of potential complications, we call the doctor that time. And these are things that you know already, it's just revision. All right. So, types of questions. Multiple choice questions is um, is what RNR does. We don't have any essay type questions anymore. Just just multiple choice. So they can be either discrete, direct questions or incomplete statements or a series of items based on a scenario, a visual stimulus, or a set of data. So multiple choice question should have a premise, which is a stem, and four choices. One choice is the key, which is the correct answer, and everything else is a distractor. So it is there to distract you from the correct answers. So that's why it's called distractors. And some of the distractors are very good because they are very close to the key and it can cause a confusion. All right. A direct question, and this is a direct question. Which of the following is the first step in applying the quality improvement process to an activity in the clinical setting? And you have your answer. Assemble the team to review, revise the activity, collect data to measure the status of the activity, select an activity for improvement, or set a measurable standard for the activity. Which is, can anybody identify which level of the Bloom's taxonomy this question is? Or should I call a name? Ebony,
Yes, miss.
can you identify which level of the Bloom's taxonomy this is?
Miss
This
applying.
question. Sorry, I didn't hear you.
Miss applying.
Applying. Um, Thank you. Let me ask somebody else. Jacia?
Miss, I would also say applied.
Okay. Alicia? Alicia
Applying.
Wallace? Hmm?
Applying.
Okay. Thank you. Shania? Redwood? Shania? If you're not
Yes,
answer when
Miss.
if you're not answer when we call you, you know me, mark your absent. Which level of the
Yes,
Bloom
I'm here.
taxonomy is this question?
Is it applying?
Applying. All right. Let me ask Beyonce. Beyonce. Beyonce is not here. All right, so we mark her absent.
Miss Wallen, um, applying.
Okay. Let me ask Kamisha Armstrong.
Yes, miss, good morning. Applying also.
Applying. Okay. Kwesi.
Miss,
Yes. Which level of the Bloom's taxonomy is this?
remembering.
Okay. Thank you. Um, Let me ask Christina Pink. Christina Pink.
I'm here, Miss. Um,
Okay.
Remembering.
Okay. Asking two more persons. Macaulay,
Miss, I'm going to say remembering.
remembering. All right. And I'm going to be asking Petrilia Thompson. Petrilia Thompson Henry. Is she here? No? All right. So I'll ask Monica. Monica,
Yes, miss.
what is wrong with this bird? What level of the is this question?
Remembering.
Okay. All right. Now I'm going to ask you. So I hear two answers. Remembering and applying. Macaulay, why do you say it's remembering?
Miss, it asks for them to identify the first step in the process, and um, I think the first step is remembering. So you're recalling something instead of actually carrying out the process.
Okay. And who say applying again? I forget. Alicia, yes.
Remembering, me mean remembering.
Yeah, Beyonce, you said applying. Why was it applying?
It's the first step in applying, so not applying.
I knew it. I knew it. I knew that's why all of you say applying. But yes, it is remembering. Yes, Ebony, it's remembering because it is asking you to recall the first step in applying the quality improvement process. So to an activity. So it is asking you to recall. So whatever you're trying to recall, that is it. So it's actually the lowest order of thinking. It's remembering. All right. So you need to know the you have to remember the steps of 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 applying the quality improvement process to an activity in the clinical settings. What are the steps? And then you just put them down. So it's just asking you to remember. All right. This is an example of a direct question where it asks you which of or what are or who is or where is, right? So it's direct and it always ends with a question mark. That is a direct question. All right. Next example. Incomplete statements. So this is a notice that for the direct question, it ends with a question mark. So all of the options available, A, B, C, D, starts with a capital letter because the sentence complete, right? So you have to answer, start with a capital letter. For this one now, the incomplete statements, it is incomplete. So all of the options start with a common letter. So the most common preventable complication of abdominal surgery is, and these are the answer. So it means that it is not finished. So the options that are available, A, B, C, D, they are there to complete the sentence. So that's another form of how they write a question. All right. The most common preventable complication of abdominal surgery is atelectasis, whatever. Atelectasis. That's how I call it. How do you pronounce it, Beyonce?
Atelectasis.
Atelectasis. Well, I pronounce it atelectasis. Atelectasis. I put the emphasis on the A, you know? All right. So there is also the best answer variety question where, all right, so this is a question. During an assessment of a patient who sustained a head injury 24 hours ago, the nurse recognizes the development of slurred speech and disorientation to time and place. The nurse's initial assessment is, and this is, so the key word here is initial, because all of these may be important in taking care of a patient, but what is the initial action? All right, so they're asking you for the first action of the nurse. So during the assessment, you're conducting an assessment of a patient who had an injury, head injury 24 hours ago, and then so you realize that the patient has slurred speech and disorientation to time and place. You must inform the neurosurgeon of the patient's status. All right. And we do not continue monitoring, and we don't prepare for emergency surgery without informing the doctor, and we don't recheck the patient's neurological status in 15 minutes. We don't do that. All right, so who can tell me which level of the Bloom's taxonomy this question is? Nobody? So I'll call names.
Miss my answer.
Who answer? Rihanna?
Yeah.
What did you say?
Applying.
Applying. Okay. Anybody else have another answer? Sirika?
Miss, you hear me?
Yes, loud and clear.
I'm saying applying as well.
Applying. All right. Let me ask somebody else. Antoya?
Miss, I also say applying.
All right. Shari?
Applying, miss.
Asking two more persons. Bradley? Kamisha?
Yes,
saying
miss, I was
something?
going. Yeah, analyze.
Okay. Bradley? Micah Bradley, if you don't answer me, I'm not going to absent, you know.
Miss,
Micah
analyze.
Bradley? Okay.
Analyze.
Got you. Makeda? Makeda Black?
Good morning, Miss. Applying.
Morning. Okay. Last person, Coley Lynn. Is she here?
Miss, she's trying to connect to the internet.
Oh, okay. All right. Bianca Reed. Bianca? Bianca, if you're not here, I'm marking you absent. Last call. All right. Jorian,
Yes, Miss.
what what level of the Bloom's taxonomy is this question?
This is applying because it's trying to use the knowledge to decide what action to take.
Okay. All right. Thank you for your justification. All right. So let's read the question again. During the assessment of a patient who sustained a head injury 24 hours ago, the nurse recognizes that the patient has developed slurred speech and is disoriented to time and place. So the nurse's initial action, it's actually evaluating which action to do first and which one to do last. So the evaluation comes in here. So it is when they're asking you which one to do with when, is actually evaluating to see if you know which action should be done first, or which intervention takes priority, or so on, or which, like, if they ever see some of the questions where they're asking, the nurse knows that more teaching is needed if the patient says X. That is evaluation as well.
Miss,
Mm,
question. So
yeah.
for the analysis, right? Analyzing part of it,
Mhm.
wouldn't, because analyze and evaluation would be similar in a little way. But look at it from that point of view, stating that the nurse has to assess the patient, as in based on the assessment, she has to interpret what is happening to the patient and then see which priority action is needed.
Um,
Miss all of them are the same thing.
no, all of them is not the same thing. When all right, when you put it like that, it is analyzing, but then the question is the nurse's initial action, which makes it the
Okay,
evaluation.
miss.
Mhm. But the nurse would have to know that this is actually something that is wrong. But the question is not um asking if something is wrong, because the nurse already recognized that something is wrong. The question is saying, asking for the initial action. So that's why it is actually evaluating. All right, so there is the other one, the multiple response question, where they have the 1, 2, 3, 4, and then you have to choose the numbers. I always never like them a question, yeah, but they are prevalent. Um, peritonitis occurs. Peritonitis may occur in ruptured appendix and may cause serious problems, which are um, hypovolemia, electrolyte imbalance, elevated temperature, weakness and diaphoresis, nausea and vomiting, rigidity of the abdominal wall, pallor, and eventually shock. So you're to choose which one is correct. And of course, peritonitis can cause all of the above. So here the question is asking you to, if you know, they're trying to figure out if you know the symptoms of peritonitis, right? Um, and if you can decipher between all of these, um, among all of these, the correct answer. All right. So there is also the combined response where um, the registered nurse is a member of a team working to design a program to reduce the number of patient falls. After determining the fall rate on the unit, the next actions of the team in correct sequence. Now, you see this or now? When me look on it, me see incorrect, incorrect, not correct sequence. So you have to look at it very good. All right. So they should not have put the IN in capital, which would not make it look like a one word incorrect. So you have to really look at it. So the next actions of the team in correct sequence will be, so you will have to now know the correct sequence of doing this Contact the risk management department, incorporate specific interventions. Which which course is this question from? Seriously? Nobody can answer?
Leadership and management, miss.
Thank you, Alicia. Leadership and management. Oh, no, I'm going to tell Dr. B. Oh, never the leadership and management. Beyonce. Beyonce.
Um,
Beyonce.
hmm?
What happened to
Yes,
you
miss.
today? What happened to you?
I'm
You're
good,
distracted.
man. No, not really. Me there, man.
You're distracted. A one person me can count on a night a daytime for talking in my class and you. And that you're not talking.
Stop me talk.
No, you're not talking, you're distracted. Everybody else usually keep quiet, but you used to talk, and today you're not,
Alright, man, I talk more often now.
which is very disappointing.
I sure will but things are going right now, miss.
I told you you're distracted. I told you. All right. So, right. So where you will have to have you have to know in this question, you have to know the correct sequence of designing a program. I read over the question. All right. Next question. Sometimes you will have to match items. So you will see this at the beginning. Item 1 to 2 refer to the following tests: respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. In answering 1 and 2, match each item with one of the options above. You may choose any of the options more than once or not at all. So you will see that those kind of questions. Um, so that is back. So the one and two, these require either of these either of these options: respiratory alkalosis or acidosis, metabolic acidosis or alkalosis. All right, so these are the questions. A client with diabetes mellitus has a blood glucose level of 644. Mighty God. The nurse interprets that this client is most at risk of developing which type of acid base imbalance. And then you'd have to go back now to, yes, beyond Ebony.
This is a mistake.
Okay, take down your hand. Right, so you have to go back and look which one of these the patient will develop. Is it metabolic acidosis or alkalosis? Is it respiratory acidosis or alkalosis? And the answer is metabolic acidosis. All right. So the nurse is caring for a client with nasogastric tube that is attached to a low suction. The nurse assessed the client for symptoms of which acid base disorder? And it is the alkalosis, metabolic alkalosis, which is D. All right, so that's some of the questions may look like that. And that is it for this section. You see it? We're speaking it into being 100% pass. All the best. All right, any questions? 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 Blueprint. Questions? Anybody? Did I send you a RNR preparation guide?
The PowerPoint, miss?
No, a PDF.
I don't think
No,
so.
miss, you didn't.
All right, I will send that. Let me send it now, so me not forget. Cause, um, yeah, that is from the. It was developed from 2014, but it's still same thing they're using. I'm sending it to you. I'm not going to go through it. You have to go through it by yourself. I'm going to just show you the blueprint, even though you have it. Um, which was revised in 2014 as well. From that, then I revised it again. I think it was 2014 that they changed RNR from the two papers, from the four papers rather, and um, cut out the written part and only have the multiple choice. That was 2014. So everything has remained the same for the written exam from then. Um, so let me show you the blueprint. All right. So we are going to go down to I'm pressing the wrong thing. Hold on. Let me press. All right, so we're going to go down to, let me just go back up and use the appendix. All right, give me a minute, please. All right, so we're going to go down to page 35 for the RNR. It actually, this has everything, all the courses that you're supposed to do during the program. So let me look at this one. All right, so RNR, the exam covers all the domains, and these are the domains. These nursing practice, which is the care given to the patient, professional conduct, which will refer to your code of ethics, health promotion, which incorporates illness prevention as well, leadership and management, how you manage the unit, communication with patient, staff, and family, clinical and decision making and intervention, your ability to make decisions, professional development, which is reflection on practice, feelings, belief, and their consequences in nursing interactions. And so this is the unit's the competence. So you can read it. Domain 1 talks about, we just went through it and how. So it is good to go through it before you actually do the written RNR exam. I'm not going to go through all of it, but I want to go down to RE, the exam itself, and show you something. This is talking about the life cycle, the nursing process, the needs. Page 35. So these are the courses that you did all through the program. They're right there. So here it is. We went through most of this already because most of the information was taken from here. 2 papers from the nursing domains and see the exam weight, which is what was on the presentation earlier, where the questions will be coming from. Nursing practice, 60 items, conduct, and so the total is 200. So the papers, the weight will be 100%. And we went through the Bloom's taxonomy already. There is something on this that I need to show you. I missed it. No. Let me also. Right. So these are the here. This is for a patient with diabetes mellitus. So when they talk about the assessment, these are what you will talk about the needs. All right. So the physiological need, what falls under physiological, what falls under nutrition, and what falls under elimination. So I noticed that a lot of persons or a lot of you will mix up the needs. I don't know if it's because the NANDA uses domains, but when we ask for needs, we're not asking for the domains that are under the NANDA. We're asking for the need, the Maslow hierarchy of needs. So we have to be careful of that. Where does rest, comfort, and activity pause, and so on. Safety and security, the blood sugar level, the condition of the skin and mucous membrane. So if there is a wound, and problem with healing and so on, that would fall under that. And then there is always a psychological need, psychosocial need of the patient, self-concept, self-esteem, body image. And I realize we don't use that diagnosis anymore. Disturbance, body image disturbance, or disturbed body image. No, sir, I couldn't tell when Missy one student write that. So the environmental, the lifestyle comes under that. All right. So the planning, or this is a problem list, so the diagnostic statements would fall here. Of course, this was reviewed in 2014, so most of them have changed because NANDA changed all of the wording, but the concept remains the same. So what are the critical area of care for this patient? And we see them there. And these are the expected outcome. Client will be free from injury or so on. So the blueprint actually has everything in it, and it's necessary for you to read it. All right. Which team is involved in the caring of this patient? We're still talking about the diabetic patient. So oxygen, these are the implementation: oxygen, nutrition, elimination, rest and comfort, and activity. Even sexuality is there. So I'm going to ask you to go through the blueprint. It is quite important, and I think you should have had this from before. I don't know if you get it, but like from third year or second year. But even if you get it, you only read it anyway. So right, but it is important. The information above too here is also important. So I'm going to ask you to go through it. And learn from it, because that's what your exam is based off. All right. Also sent a document in WhatsApp. It's almost like the blueprint, but there are other information in it, so you can read that as well. Okay. Yes, Michaela. Kuya. Michaela, just a come to school? I think her hand come up. Michaela, you just a come to school?
No, miss.
No, no, me just admit you in.
Miss Comedy log off.
I wonder why you don't log off. Name me your class.
Miss, I was here.
You log off, what did you say?
Miss, it
Anyway,
drop on.
this is the second time you're coming to school at the end of the class.
Miss, I was here. Ask anybody.
All right, so thank you for tomorrow. Tomorrow we are going to do leadership and management. So please prepare yourself for that. And the next day, hold on, what did I write? So tomorrow is leadership and management. So please review your notes. and Wednesday, right? Wednesday we are going to be doing communication. Communication, yes. And then you have another test because I normally give a lot of tests or a lot of practice tests. So you have another test this week. It's either Thursday or Friday. I'm trying to determine when, but you'll get it. All right. Hello.
Yes, miss.
Yes,
Okay,
miss.
miss.
Yes, miss.
God. All right. So for the rest of the day now, you have self-directed learning. I am expecting that you will continue to review your courses, whichever course you want. Leadership and management is coming up, so you may want to apprise yourself of that. And communication. Also, the blueprint, you need to go through it because it is necessary. It helps to know what is tested, how it is being tested, and also other other courses wherever you think that you are weak. Mrs. Graham had classes with you last week, or she never have no class? Did she start on Wednesday? Wednesday?
Yes, miss.
Oh, so you got cut off in the middle.
Yes, miss. And the next day, she also didn't have any light. So
No,
just
okay.
one class.
Okay. So what you started? Health assessment or parent child?
Parent child.
All right. So me testing upon parent child as well. Alrighty. Take care and see you tomorrow.
Bye, miss.